Dr. Chang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Sarah Ho, Chief Manager, Hospital Authority. Dr. Chang will first brief us on the cases. Good afternoon. Yesterday, we had a total of 1,076 additional local positive cases, including 429 tested positive by PCR tests. And as for the number of RAT positive cases verified online, there were 647, and we had 127 imported cases, 98 that tested through PCR tests, and 24 verified cases submitted online that tested positive through RAT. In the fifth wave, there has been a total of 1,216,579 cases. Of the positive cases, 69 were detected at the airport upon arrival. "38 cases arrived in Hong Kong on the 20th. 31 cases arrived in Hong Kong on the 19th via 8 different flights. 42 cases were detected at quarantine hotels, of which 11 patients left the hotel already. The CT values were very high and they were likely to be repositive cases. No new deaths were reported today. So the total death toll remains at 9,183 so far in the fifth wave. In terms of residential care homes, a Ngai Chun elderly home saw one carer who tested positive. She last went to work on the 18th. The test result on the 19th was negative, and the test result on the 20th came back positive. 6 residents from that care home had to be quarantined for schools. There were 177 positive cases reported today, covering 144 schools, including 30 kindergartens, 75 primary schools, and 71 secondary schools, as well as 1 special school. Among the 177 positive cases, 97 tested positive this morning, 80 tested positive yesterday afternoon or earlier. The 177 positive cases included 143 students and 34 staff members or teachers. Over the past week, 45 schools saw 2 or more positive cases. For 2 of the schools, some of their classes had to be suspended today, including the Ng Yap Sito School in Kwun Tong. It was called Wu Yi Sito School. Class 2C saw multiple cases. There were 34 students in that class, and this school had to suspend classes for a week. For Chunwan, St. Francis Xavier School, there were infections among a basketball team. 17 students attended training for basketball, and there were 7 confirmed cases. And the basketball team consisted of secondary 1 to 3 students, and we asked students from the basketball team to stop attending class. As for a Thai boxing class, multiple teachers and students tested positive, and the class had to be suspended. For St. Stephen's College, yesterday 3 students from class 5Y tested positive. So face-to-face teaching for class 5Y has been suspended, and today teacher who stayed in the same hostel, and we will continue to monitor the situation. In terms of the subvariants, among the imported cases, we saw new subvariants as of yesterday. There were 200 cases of BA.2.1.2.1, and we had 64 new cases of BA.5 today. For the Omicron subvariant, BA.2.1.1 saw 14 additional cases, and some of them were related epidemiologically. For the CCC K1 Primary School in Aldrich Bay, Class 5C had 4 new cases today, and like we reported yesterday, the class was suspended yesterday. One of the cases was suspected to carry the BA.2.1.2.1 subvariant, and the patient lived in Heng Cho House, Heng Tong Estate. Another case lived in Long Hang Estate of Tai Po, and it was related to another prior case, and it was the 9th case in the related cluster, and 2 of the patient's family members also tested positive, so there were 3 cases total. Another 2 cases were family members of known prior cases. They were under quarantine already. One lived in Hoi Lai Estate, another lived in Block 5 of Aquamarine. There were a number of untraceable cases. Fupong Building, Chatham Road, North, Tsim Sha Tsui, there were 2 cases, a patient and one of his family members. There was a family of 3 living in Tong Lai Court, and these cases were untraceable. That's all from me. Dr. Ho will brief us on the situation of the HA. Good afternoon. 509 confirmed patients are currently staying in hospital. 79 were newly confirmed patients. Among the isolated persons, 168 were staying in isolation beds, 11 were staying in tier 2 beds, 121 patients were staying in the North Lantau Hospital Hong Kong Infection Control Center. 58 were newly confirmed COVID patients. Yesterday, there were no newly reported patients in critical condition, and 2 patients were in serious condition. Of the hospitalized patients, there were 14 in critical condition and 11 in serious condition, and 2 of the patients in critical condition were staying in ICUs. Over the past day, no COVID patients passed away. 54 patients recovered, including 50 who were discharged. Since the 5th wave started, 51,322 patients recovered. 50,932 were discharged. Since the start of 2020, 63,702 patients recovered, including 63,312 who were discharged. Another 2 patients were found to be positive through the admission screening. 2 patients were classified as close contacts. And for staff members, 23,919 contracted COVID so far. 23,780 have returned to their posts. Thank you.
Q&A time. Would you please raise your hand before asking your question, and please also introduce your organization. Thank you. The gentleman at the back, please. Greetings, Doctors. Ming Pao. A question about the school case. Just now, it was mentioned that the BA.2.12.2 cases, there is a suspect case relating to the CCCK1 primary school. I would like to know, concerning this school, the concerned case, did the person come into contact with any of the previous BA.2.12.2 case? And is it likely that the case would be related to the other cases? And secondly, about the Chunwan St. Francis Xavier School, the basketball team that was mentioned just now, involving Form 1 to 3 students, and also the Thai boxing class. Exactly how do you see the risk for these relevant classes? Is it possible that these classes in the school will have to stop face-to-face instructions? As for the old age homes, there had been consecutively a few old age homes with cases, including the Shatin situation yesterday. My question is concerning the 5 cases. Does the CHP have any idea about the infection chain? And have you gone down to inspect the environment? Let me see. First of all, concerning the Aldrich Bay CCC K1 Primary School, there were 4 cases reported yesterday. In one of the cases, we find L452Q, and we suspect it is to be an Omicron subvariant BA.2.12.2. The other cases have not gone through genome testing yet. But we suspect that the other cases are also BA.2.12.2. So far, we do not have any proof of connection with the other cases. So this is one of the cases within the cluster. As for the St. Francis Xavier School, there are 17 students in the basketball team and 14 students in Thai boxing class. And for the latter, it is Form 1 to Form 5 students. As for the basketball team, it is Form 1 to Form 3 students involved. At present, we do not see other classes or forms being involved. But of course, we will continue to monitor the situation to see whether there are other infections. For basketball and Thai boxing, during the exercise, even though it is outdoors, but they have taken off their masks and there is contact. And we believe that the infection occurred during exercise. As for in classroom, the possibility would be lower because they would have their masks on. As for the old age home situation yesterday, so far we have not found the source yet. The 5 cases concerning the residents, we believe that they are BA.2.2 related cases. Next, the lady over there. Greetings, doctors. 01. A question about the old age homes. There are some clusters and infection cases in the various homes, and experts seem to be saying that the residents at the old age homes are given Sinovac shots for vaccinations in the residential homes, but there is indication that BioNTech is actually more effective. Is there a plan to have BioNTech shots? And further, for the Penny's Bay and some of the other quarantine facilities, will you be considering using these quarantine facilities to reactivate them? And also, 9 a.m. this morning, there were 47 PRC positive tested cases in Macau. At what level of positive cases would Hong Kong readjust the entry requirements? Concerning vaccination shots, the relevant colleagues will have certain arrangements. I do not have the details concerning that. As for quarantine hotel, in the mainland, we I do not have that information. As for Macau, we are monitoring the situation. If necessary, we may have to adjust our entry policy and requirements. The lady over there. Greetings, Now TV. On the 1st of July, there will be various celebratory events. What are some of the requirements and conditions for the people attending these events in terms of quarantine or prevention requirements? Now, various specialists have various views concerning the trend of COVID. How do you see the next few weeks or the month? How do you assess the risk level? I do not have detailed information, but for relevant events, I believe there would be certain conditions to be met before the prevention of outbreaks can be satisfied. Different special experts will have different views on the situation now. We will closely monitor the situation. At present, there is a gradual rise in the number of cases. We note that. The lady over there. Orange. First of all, for the Thai boxing class in Chinwan St. Francis Xavier, now the instructor had been a confirmed case. Apart from teaching the classes, does a person also teach other classes? Now, as for the other school with 4 cases among the students, I'd like to know whether there is within the class or the classroom there is airborne transmission, or is it because of contact among the students? And also for the old age home reported today, are all the residents fully vaccinated? And in the 5th wave, had there been a outbreak in this particular old age home, please? Concerning the Thai boxing transmission, I will have to find out whether the instructor had also taught the other classes. And even so, we will be monitoring all the cases, and all the teachers and students would do RAT on a daily basis. If there is no transmission situation, we see they can have their normal classes. At present, as you all know, Omicron is more contagious, and for the same level or class, there is some transmission. In the past period of time, we did see 3 or 4 cases in the same form, and it is difficult to say how exactly the transmission took place. But luckily, we are doing daily RAT at the schools. We do not see major outbreaks so far. As for the old age home situation, at present, I do not have more details. All I know is that for the first vaccination shot, let me see. Yes, those who have received the full vaccination number of shots, the percentage is high, and that can avoid or prevent critical or cases or deaths, but there may still be infections. The lady at the back, please. Greetings, Economic Journal. For St. Stephen's College, how many are under quarantine in the dormitory? As for the basketball team and Thai boxing class in St. Francis Xavier School, are there other cases involved? And I would like to know, just now you mentioned there is a transport infrastructure project. Is that in the Nam Wan construction site, and how many are involved? Family members included?
For St. Stephen's College, there was transmission taking place among Class 5Y, and some of their students stayed in a hostel. So we considered all individuals who stayed in the hostel close contacts, and they had to be quarantined.